Hello, my name is Dr. Chinwe Okudo. I bring you greetings from Balm of Gilead Health and Wellness Center. The month of May is Children's Mental Health Awareness Month, and today being May 5th is Wear Your Green Day as we raise this awareness for our children. Our children's mental health is just as important as their physical health, but sometimes we tend to overlook this vital aspect of our children's care and tend to focus on their physical health alone. According to NAMI, which is National Alliance on Mental Illness, they report that 1 in 5 teenagers ages 13 to 18 will experience one severe mental health disorder in their lifetime. And also 13% of children ages 5 to 15 years old also experience such. Also, it's recorded that children with depression tend to have other mental health disorder. And 3 in 4 of these children with depression also experience anxiety disorder. Fear and sadness can be common in children depending on the stages of their development. For instance, a toddler may experience some form of anxiety when you take her away from her caregiver, even though they're well taken care of by the next person you're taking them to. Other children may experience fear of certain things like pets or getting on the plane. However, when this fear becomes severe or they fail to outgrow this fear as they grow up, that is a call for more attention, as this could be leading to a diagnosis for anxiety. It's okay for children also to feel sad from time to time, but also note that when these feelings of sadness becomes more intense, then it's a call for you to pay close attention as something else may be going on. There are a few symptoms of anxiety that I want to list out for us to pay attention to. When you notice that your child is having an intense fear, especially maybe when it comes to going to school, they are frightened about going to school, they are frightened about going to a provider, or frightened about a pet, that could be a phobia and might need to be assessed. Sometimes when you notice that your child is having a severe panic attack whereby they cannot catch their breath and they're shaky, sweaty, and they cannot function with certain situations that they should be able to handle normally, that could be a cause for you to reassess or refer to someone that is trained to assess the situation. When it comes to feelings of sadness, yes, both adults feel sad from time to time, so does our children. But when you notice that your child is constantly feeling sad, or also you notice that they're feeling helpless, worthless, or you see them losing interest in activities that they usually would love to engage in, that's a call for you to pay close attention, that something might be going wrong. Also, when you notice that your child is beginning to have sleep difficulties or eating problems, whereby they're either eating too much or eating too less, please pay close attention, as something might be going on with your child. Depression is known to lead to suicidal ideation, or actually carrying out the suicide. Studies suggest that suicide, aside from accident, is the leading cause of death for children ages 10 actually to 24. So this is something that we need to pay close attention to, making sure that your child is not predisposed or experiencing some of these troublesome concerns. How can you help your child to ensure that their mental health is what it needs to be? At least we can start by loving them unconditionally, paying close attention to their feelings, asking them how their day went. Also, being able to share your own feelings, how your day went, how you're feeling, because that's a way to get them to share their own feelings, when you could comfortably and age appropriately share your own feelings or the struggles that you're having as an adult. That makes it more easier for them to share their own feelings with you. But when you notice that something is going on, for some children, they might be able to express those symptoms of depression. Some may not express that typical symptoms of depression, and sometimes may be labeled as being lazy or being troublesome. When you are not able to dig into what is going on with your child, it's time to seek a professional help. Please do not feel or ignore the signs and symptoms of any mental health disorder in your child, as this could be dangerous. If you notice that your child is experiencing any of the things that I discussed or more, please do not fail to seek professional help. At Balm of Gilead Health and Wellness Center, we actually take care of children's mental health conditions. We care for children ages 5 and above. So if you feel that your child is struggling in any way, please do not fail to give us a call at 443-868-7405. We are here to work together with you as we raise the awareness of our children's mental health, making sure that they grow up to be strong and confident members of our society. Thank you all for listening, and do have yourself a great day. Bye.